Yeah, I'm a big fan of creating templates and checklists. I think you can go through a checklist pretty quickly. And actually, depending on how the office is set up, this is something that a family could complete while they're waiting for you to come into the room. So, simply put, if you had a checklist of the four health factors, four health behaviors, maybe a family is asked to put, you give them a range of what's acceptable, poor, good, ideal, or poor, fair, ideal. They kind of check it off. You can kind of quickly look at that list and see where the child falls and maybe target the visit for those particular areas where the most intervention is needed. You can also have things that are available in the room. We do have materials that we've created through the American Heart Association. We created infographics for all of these health factors and behaviors that are easily accessible on the web. But I think the more people hear, part of the reason why I do interviews was like this is to get the word out, to make sure that people are aware of the relationship that exist, to know that it is important. So posters in the room, links to the infographics and the after visit summary, a quick check-in sheet that families can check in while they're waiting for the provider to come into the room. All of that can be helpful. Um, Including the templates as we started this interview with questions about sudden death, um, thinking about adding some of those questions to that, pink sheet or whatever the form is that they fill out while they're waiting. Just is there a family history of heart attack or what was diagnosed as heart attack or stroke before 55 in men or 65 in women? Did anybody die suddenly without known cause? Those sorts of questions can be helpful in elucidating. And if any of those things are positive, I know we've set up our preventive cardiology referral that if there's a family history of premature heart disease, that's a referral to us, and so that we can take a deeper dive, help the provider, help the primary care. Yeah, blood pressure is challenging because often it's not measured correctly. So you want to make sure, first things first, if the blood pressure on the sheet is elevated. So there's a quick phrase, it's .bpfa. So B as in boy, P as in Paul, F as in Frank, A as in Apple. If you have Epic, you can type that in as long as there's a height and a blood pressure entered for that patient. If they're under 13, the percentile will come up automatically in your note. And if that's 95th percentile and above, then that's an abnormal blood pressure. And so if the blood pressure measured by, say, the medical assistant or the nurse measured 95% or above under 13 years of age, that's a blood pressure you want to have a process for repeating manually. It's really, really important that the arm is supported, the feet are planted, the back is supported. You're not checking the blood pressure on the examination table, but they're actually seated at a table with a desk with the arm supported, the right arm. The normative values are derived from the right arm. Preferably, you have an appropriate, well, I should say, preferably the arm is exposed, but also important is an appropriate size cuff. So 40%, the bladder width should occupy about 40% of the upper portion of the arm, or 80 to 100% the bladder length to the upper arm circumference. And you want to make sure that the person's had a chance to rest. So often what I do is I have the child sit in the chair, make sure they're, again, back is supported, arms supported, feet flat, their hands aren't fisted, their legs aren't crossed. I talk to them about what's happening in school or medications or allergies or what have you, just for about 3 to 5 minutes. And then I check the blood pressure. Now, if the blood pressure is still high after that, depends on the stage. If it's very high, so then you're going to think more immediately, depending on your level of comfort with referring that patient right away. If they're 13 and above, you're going to use the same adult cutoff. So 130 over 80 is what we currently accept as hypertensive. So 130 systolic, 80 diastolic. You repeat those measurements. We do ask for an average, although some will just use that last one. And if the blood pressure measure is high, it is possible that the child has white coat effect, but it's also possible that the child has hypertension. And so important then is to have a process. So often that's bringing them back for repeat measurement. We know that that doesn't happen all of the time for lots of reasons. And so, if necessary, you can refer the patient to the subspecialist, although the guideline will say repeat the measurement at least a second and a third time, particularly if it's just in the stage one, 130 to 139 um, over 80. As it gets higher, that's when you have a second repeat and then a referral. Even in the higher stages, sometimes that's still white coat, but often we're thinking about, obviously true hypertension in that case. Now, what makes this a little bit of a challenge is that the often, kids can have white coat effect, meaning they can have blood pressures that are just high because they're nervous in the office. And so, in that case, the gold standard is to have them wear what we call an ambulatory blood pressure monitor. Now, that device, we have made that available to some of our practices as point of care for the pediatrician. And that's a device that kids wear for 24 hours on the non-dominant arm, and they wear it at home. That's a nice device because it gives you about 40 to 50 measurements. It lets you know if truly the blood pressure is high at home. But for the regular run-of-the-mill day pediatrician, it's a measurement if it's elevated or high based upon the age, so 95th percentile and above for under 13, 130 over 80, either or, and above for 13 and above. It's a repeat measurement and possibly a second repeat, so three total visits with a referral to a subspecialist for further evaluation. In the meantime, it's really important to talk to families about salt intake and also about fruit and vegetable intake. So many kids still, their diets aren't very good. There's been some studies looking at, we know what the recommended intake of sodium is. Many Americans exceed that by threefold. So if we target for less than 1,500 milligrams per se of sodium per day, many get closer to 4,500 milligrams of sodium a day. For those of us who are salt sensitive, who retain water with that salt, that means our blood pressures can be high. So sometimes, even in between the first and the second visit, right? So the advice is remove that processed food, salty snacks. If you're using a salt shaker, avoid use of that to get to see if that helps to positively impact the blood pressure. Things like increasing fruit and vegetable intake during that time also. But where the hidden salts come in are processed foods. So anything that can easily warm up, you can just pop in the microwave. Usually, a lot of those foods have a lot of salt and sugar. So trying to avoid those foods can be very helpful. So I know that's a lot of information, a lot of things to consider. Um, the easiest way to think about it is uh, it's like closer to the ground you can get. So the fresher, the better. And repeat measurement and technique matters.